So I explain what we're going to do. So Andrea, you wouldn't be sitting in the chair unless you had a temporomandibular joint problem. Okay?
Okay.
So what I'm going to do is we're going to check to see how sore your muscles are. What we find is if your jaw's in the right position, when I palpate the muscles, they won't be sore.
Okay.
But if the jaw's in the wrong position, they'll be a little sore.
Okay.
So it's going to be like, this would be like pressure.
Yep.
Okay, if you feel that, that's okay. You say that's fine. That doesn't hurt. If it's uncomfortable, you tell me it's a 1.
Okay.
If it hurts, it's a 2.
Okay.
If you want to hit me, it's a 3.
Okay.
Okay, okay. That's the bad one, okay?
Okay.
I don't think that it'll be bad because you don't have that bad a problem.
Okay.
I think your problem is you're just clenching a little bit, right?
Mm-hmm.
So your certain muscles will be a little sore, but I know which ones they'll be.
Okay.
So we'll be easy on you, okay? Because we want you to come back.
Yes.
But I also have to find out, now we'll be doing this a couple of times.
Okay.
We do this at the initial appointment to see how sore your muscles are,
Okay.
okay? And then we'll also do it maybe a couple of months into treatment, and then at the end of treatment to see that things are getting better, okay? And Tara there is going to record everything. So I'm going to call out the muscle, and then she'll record whether it's okay, a 1, 2, or 3. I doubt if there'll be any 3s.
Okay.
Probably uncomfortable will be what it is, okay?
Okay.
So the first thing I'm going to do is I'm going to do this to you. That's the about way I'm going to press, just like that. And so you'll see what I'm going to do. So the first one, that's your temporomandibular joint right there. You're just going to open a little bit and move your jaw to this side. And I'm going to, so she's moving her jaw to the right, and I'm palpating the left temporomandibular joint, but I'm also supporting the head on the other side. Because if I push here and don't support the head here, she'll go over this way. We don't want that. So what does that feel like right there?
1.
1. I'm putting about 5 pounds pressure on. Okay, if I put more than 5 pounds pressure on, that would be really uncomfortable. Okay, so that's 1. Okay, so now we'll do the other side. So now you're going to just turn your head this way then. And just open a little bit. Move your jaw to the left. We'll palpate the right side. What's that feel like?
Fine.
That was fine. Right side is 0. It's okay. The left side is a 1, uncomfortable. Okay, good. Okay, so the vertex is a little depression. The head be halfway between the frontal bone and the parietal bone. So I put my hand on her forehead like that, and I feel for a little depression right there. And some people have a nice depression, some people don't. Hers isn't that prominent. Press down there. How does that feel, Andrea?
That was fine. Yeah.
That was okay. Okay, that's fine. Okay, now we're going to put your head back, and we're going to check your maxillary sinus. Do you have any sinus problems?
I don't think so.
Okay, so we're going to press just below the orbit of the eye. We're pressing up like that, 5 pounds pressure. And she said that was okay. And now we're going to do the frontal sinus, which is just the upper orbit of the eye, pressing up like that.
Fine.
That was okay.
Yeah.
So no discomfort, so just 0. Okay, that's great. Okay, now the next thing we do is we're going to check the side of the neck. Okay, now Andrea's a massage therapist. So she might, she's going to school to be a massage therapist. So you might have sore shoulders from actually, you know, working with the patients, right?
Mm-hmm. Yep.
Do you think you have sore shoulders today?
I do.
Okay.
I always have them.
Okay, always have them. Okay, so that's so we're just going to grab there and just sort of do that. Does that kind of feel uncomfortable?
Yeah, that's a 1.
That's a 1. That's uncomfortable. But then that might just be due to both sides. That might be just due to the fact that it's her employment problem. You know, a normal patient who's not a massage therapist wouldn't maybe have that problem. So now what we'll do is have her lean forward a little bit. And her trapezius muscle, we're going to check the top of the trapezius, okay? So we're going to palpate her muscle in various areas all along the back. And I'm doing this bilaterally, actually. And what's that feel like?
The left side's a little bit more sore than the right side.
Okay, so the left side, I think we'll give a 1, Tara, and the right side will give 0. Now the next one we're going to do is we'll do the SPLENIUS capitis. The SPLENIUS capitis comes up just right there. STERNOCLEIDOMASTOID comes up, and just where it hits the skull, it's right here. And that is frequently sore with a TMD patient. How's that feel?
That's okay.
It's okay, good.
Yep.
So that's good. And then we're going to do the occipital back here. Palpate all along the base of the skull, which is called the occipital area. And I'm putting pressure on. It's not just like this. I mean, I'm putting 5 pounds pressure on because you have to see if the muscles are sore. And then we come over here. See that sternocleidomastoid muscle tightening up right there? Come right up behind that muscle. right behind the muscle, right there where the muscle meets the occipital base of the skull. So where occipital bone meets the base of the skull, right there, we press. And on a TMJ patient, that is really sore. But she was okay?
That was fine.
Okay, so occipital was fine. Splenius capitis muscle was fine. Okay? Now what we're going to do, and all those muscles were palpated when the muscle was relaxed. Now this is the first one we palpate when the muscle's actually contracting. So we're going to have you move your jaw forward. Okay? And we're going to palpate right under the angle of the mandible, the anterior digastric right there. Okay? So this muscle is contracting now. This is the anterior and posterior digastric. So the digastric muscle starts back here, the mastoid process, comes under here, attaches with a fibrous loop to the hyoid bone, and attaches on here to the right below the chin, right there. Okay? Now, if a patient is class 2, do you have any idea what a class 2 is?
I think so.
Okay. That's a patient. Class 2 is a patient with the jaw back too far. Okay? Now you can see that she has a very nice class 1. Beautiful teeth, beautiful bite, okay? So her jaw is not retrusive or recessive. So I would not expect this muscle to be sore with her, okay? So we'll have her bring her jaw forward, stick her jaw forward again, and right at the angle of the mandible, I'm going to press up there. Okay, so I'm going to press there, and I go gradually. I don't go 5 pounds right, I go 1, 2, 3, 4, 5. Is that okay?
Yep.
Okay, just move your jaw forward again, and right there at the angle of the mandible, press up. And remember, if I gave her 10 pounds or 15 pounds, you could hurt anybody. I just give her the 5 pounds, and she's okay. Now, if you were class 2, that would hurt. So we tell our patients, and usually the mothers are in the room. If it's a teenager or a child, I want the mother to be in the room, because if you start doing this, and it's a young girl, like she's 12 or something, and she'd wonder what it's doing, because dentists don't normally do this, right? Dentists usually work on your teeth.
Right.
But because I'm worried about your jaw position, and if you clench and brux at night, I have to examine these muscles. But so far, you're doing very well. It doesn't look like you have a major problem. Head to the side, and she's got a beautiful SCM. Look at that muscle, just stands out like that. But you have to turn the head to the side to see it. So we're going to palpate this muscle when it's contracting. Okay? Okay, I'm going to grab way down here, and I'm going to palpate it all the way up. If she says, ouch, I'll stop. But so far, she's okay. No problem?
Yep.
Okay, so that's fine. Okay, so now we're going to do the same thing. So turn your head to the side, again. Okay. This is one of your best features. You've got a beautiful sternocleidomastoid muscle. I mean, you know, would you like me to take a picture of this and we can show it to some of your boyfriends? I mean, this is wonderful. She's really got a good muscle here. Yeah, that's good. And so the temporalis muscle now is in this temple area right here. Okay? And it's interesting because I tell everybody if they want to find it, what they should do is have her clench her teeth together, and that muscle will contract. So if I palpate here, I can't feel it. But if I palpate here, I can feel it. Palpate here, I can feel it. Palpate here, I can feel it. And back here, I can't. So when you're trying to find out where the muscle is when you're beginning, you can have the patient clench and feel for the tightness of the muscle. But we palpate it when they're relaxed. So you can relax now because I know where your muscle is, and you do too. So then again, we're going to do it bilaterally because if I start pushing here, her head's going to go like that, and that's not going to be good for her. We don't want to have a sore neck at the end of this thing, so I'll be supporting her jaw on this side, and I actually palpate bilaterally. Okay, so I'll be, and I sort of, the temporalis is right here, so I'll palpate there, and then a little behind it, and then a little below it, sort of in that area, and then you're going to tell me what you think of that.
1 on this side.
Okay. And I like to face the patient. Some practitioners like to do it from behind, but I want to look at her eyes, because if she was having trouble, her eyes would be watering a little bit, and you would see it, and you'd see the discomfort in her face. So I want to see it, because some patients are really sensitive. And if they're really sensitive, I'm not going to give you 5 pounds pressure. If I knew you're really sensitive and I put 2 pounds pressure on you, said ouch, 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 I would give that a 3. That'd be severe, because I know if I gave you the 5 pounds, it would be severe. And it's also very important that you don't do this fast and do 5 pounds. You would go gradually, because some patients are sensitive at 1 pound, 2 pounds, and some patients are not even sensitive at 5. So you have to do it gradually. Okay, so now we're going to do the medial temporalis. So that's the anterior temporalis there, just behind the eye. And the medial temporalis is kind of a little way back, just in front of the TMJ, actually. So we do the medial temporalis, and again, I do it in a couple of different areas like that. And how was that?
And 1 on the left.
Again, one on the left. Most of the problems seem to be on your left, eh? Yeah. So again, we can just palpate right there. Now we're going to do the posterior temporalis. So this is back just in front of the ear. So we're going to palpate that area right there on both sides. And usually the posterior temporalis is okay.
Yep, that was fun.
Now what was interesting, you told me that you have a clenching problem. And clenching, that temporalis muscle usually contracts all night. And when that contracts all night, you end up with headaches. And did you used to wake up with morning headaches?
Sometimes.
Sometimes.
Yeah, not all the time.
Not all the time. Because that, when you're a serious clencher, usually you wake up with morning headaches. Because you're just clenching all night and that muscle's being squeezed and the nerves are being squeezed, and that's where you get your headaches.
Yeah.
And also you get soreness down here in the master muscle. So we're going to do that one in a few minutes. Okay, so that's the temporalis, 3 different spots: anterior, medial, posterior. Okay, now we're going to do the superficial masseter. So what we do, again, we're holding the jaw on both sides so the head won't go over. We're palpating just along the zygomatic arch, just below the zygomatic arch, right there. Right there. And that was okay?
Yep.
Okay, doing it bilaterally so her head won't go over when I press here. There's the zygomatic arch right along there, and that's okay. Okay. Now the next one I'm going to do is called the deep masseter. And this is probably the most sensitive one, particularly when patients are clenching.
Okay.
But you have an appliance to stop you from clenching. Right. So we'll find out if it's working now, won't we?
Okay.
Okay. Okay, so right there, just below the zygomatic arch, right in front of the TMJ. So there's the tragus of the ear, there's the TMJ, and there's the opening right there. So it's just a little depression right there. And we'll find it over here. Now we'll just press a little bit on that.
I'd say it was a 1.
A 1, so just a little bit, okay.
And that was on both sides.
That was 1 on both sides, okay. So uncomfortable both sides, okay, that's good. Now the next one we're going to do is we're going to do some intraoral ones now, okay? So you can stay there if you want, just open. I'm going to, between my second finger and my thumb, I'm going to pinch, second finger and thumb, I'm going to pinch the muscle. That's the body of the master muscle. So just turn over that way, and we're just going to pinch it like that.
That was fine.
That's fine, okay. So we'll do that one now. Okay, we're just going to pinch it right there like that. That's okay? A 1.
Yep.
Okay, most of the time it's on that left side. Yeah, that's good. Now all of this is being recorded by Tara. Okay. So we'll show you at the end how she's recording 0s, 1s, and 2s, whatever. This is our initial examination. And then if we put a splint in for you or whatever we're using, we will then check you in 3 months and then check you at the end to make sure you're getting better. Because we know if your muscles, well, you know, like from massage therapy, if your patient's muscles are less sensitive and less trigger points, they're getting better, and your treatment is working.
Yes.
Yeah. Okay, so using the muscles as a gauge of health is a very important part. Okay, so that was that. Now the next one is the lateral pterygoid. Okay, so we're palpating the lateral pterygoid. We have the patient open wide, and then move the jaw to this side, which we can't do here in this model, but the patient would normally move the jaw there, and I would go up there with my little finger and palpate right behind the 3rd molar right there. Now, if my nail is a little long, we might ask for a mouth mirror. I'll do it with this, but I won't press too hard, because we really have to make sure that your nails are cut, you know, short. And if it's a female and she's got longer nails, then we recommend that you use a mouth mirror and put up there, okay? So I won't press too hard, but we'll just, so we have you open, and because I'm palpating the left side, I'm going to have you move your jaw to the left. Okay, now I'm going to go up here behind the 3rd molar. It's really hard to see that because I'm sticking up way up behind the 3rd molar and going like that.
That was a 1.
Now what I'm going to do is if you've got a big long nail on your baby finger, then you should use a mouth mirror. And so we do the same thing with the mouth mirror. Just shift your jaw that way. And just with the mouth mirror, we just press up that area. Okay, just right up in that area. Yeah, and so usually that's our worst one. That's our worst muscle. If you had a major joint problem, if your jaw was dislocated, in other words, your jaw was too far back, your disc was in front, and you were clicking, that would be something that really would hurt. But your jaw is in perfect position. So you've got a nice bite and your jaw's in perfect position, so it doesn't hurt. So we'll do the other side now too. So we'll just, again, move it to the other side and just go up behind the third molar like that. And I always do this at the end, because if you were really sensitive all through this procedure, I would really be very gentle with this one. Because you can actually take a patient off the chair. She'll actually lift up in the chair. As you lift up, she'll just lift up because it hurts so much.
Yeah.
But you don't have that problem, so that's good. So the last one we're going to do is the medial pterygoid. The masseter muscle comes down from the zygomatic arch and hooks on the lower border of the mandible and the angle of the mandible right here. So that's on the outside, it's rhomboidal in shape, and the inside muscle is the medial pterygoid. So that goes down on the inside and attaches on the angle of the mandible. So I always ask the patient if she has a gagging problem. Because, I mean, it doesn't, when you have impressions taken, everything, it doesn't matter, you brush your teeth, you're fine, everything's cool. So I'm going to take my little finger and go down, again, behind the third molar, right down there, right at the bottom of the jaw, and right down there, as far as you can go, right down there in the lower border of the mandible. What's that feel like?
1.
1? Okay. So let's go the other side. So again, I'm putting my finger in there, I'm going down, trying to get the inside of the angle of the mandible, as far back as I can go, behind the third molar, and down low.
That was a 2, I'd say.
That was a 2. Okay, that's our first 2. Was that our first 2?
That's our first one.
Our first 2. We don't like high numbers. It's like golf. We like low numbers, but that's okay. But I would say she does not have a significant TMJ problem. You know, and when we examine our orthodontic patients, a lot of them are fine, and our sleep patients, but when we do our TMD patients, most of them are pretty sore. But that was good. I'm glad we didn't inflict anything. The medial pterygoid and the lateral pterygoid are the most sensitive, so those are the ones we do last. So if the patient has been jumping and really in trouble all the way through, we're very careful when we do the lateral pterygoid to be very gentle. And again, if I just put 1 or 2 pounds pressure on, the patient says, ouch, I would give it a 3. Because I know if I give her 3 pounds, or 5 pounds, sorry, if I give her 5 pounds, then I know it's going to be really sensitive. We want our patients to understand that they have a problem, but we certainly don't want to hurt them. But so we'll go on a sensitive patient, I'll go less than 5 pounds. If I get a positive response, I'll give it a 3. Because I know if I give it a 5 pounds pressure, it'll definitely be very sensitive and they will not like it. I mean, sometimes if you're not gentle with this technique on a sensitive patient, you can even induce a headache, and you don't want to do that. So we try to be good diagnosticians without inflicting any discomfort on our patients. And most of the time, even though you're hurting them a little bit, they understand that it's necessary, and they appreciate what you're doing. And also, they're very appreciative when we do it at the end of the treatment, and when we touch their muscles again, they're much less sensitive.